Hello, everyone. Today, we are going to talk about a very important topic and something that is very trending, which is your sleep health. So today I have with me Miss Candice Tang. Candice is our senior sleep therapist. Candice has years of experience in sleep therapy. She has a medical sciences degree from University of Sydney. She has worked at North Shore Private Sleep Lab. She is a accredited sleep therapist at Sydney Adventist Hospital, and she has worked with us at the Sydney Respiratory Clinic for 7 years now and had been looking after my patients fabulously. I was going to talk about common questions that patients ask me that Candice can answer a lot better than me. I see a lot of sleep apnea patients. Usually it's a referral from the GP because the patients are really tired during daytime or they snore. Sometimes it's their partners who complain about snoring, and sometimes it's work assessments for truck drivers, train drivers, or occupational assessments. When a patient is diagnosed with sleep apnea, there are many ways to treat it, but CPAP is a very common method of treatment. Of course, the treatment has to be tailored to the patient. So CPAP doesn't suit everyone. But let's say when a patient sees a sleep doctor like myself, and then when I recommend CPAP, the biggest problem that patients have is, how do I know what mask is the right one for me? And how do I know what machine is the right one for me? Do I just go and buy it? And the answer clearly is no, you do not go and buy a CPAP machine or a mask online. You do need to have what is called a trial of CPAP. So Candice, can you explain what a trial is and what you do when I refer a patient to you?
Yeah. So when we receive a referral from a specialist physician, first we look at the medical background of the patient. For some patients, for example, if they have reflux, there are certain masks that we need to be considering, but that's later on in the trial. But we look at the referral, we will set the prescribed pressure setting to get the patient to start trialing a minimum and the maximum pressure of the prescribed pressure as an automatic pressure setting to see how it controls people's sleep apnea. First, I'll probably also explain the concept very briefly. Patient already seen the physician, so they've got all the medical knowledge, what they need to know, but we'll just simplify it and then quickly mention what is sleep apnea so that they understand a little bit better. And then what the purpose is for the trial. The whole purpose of using the machine is to make sure it controls patient's sleep apnea so that they know it is quite important that they need to commit to the trial and what the trial is for. So the whole purpose of the trialing of the machine is to make sure that controls their sleep apnea back to normal. And in the trial appointment, we normally do the mask fitting and then show them different types of masks, explain different types of machine, different mode of the machine, and tell them what they would be going through and help them find the most comfortable mask during the trial. We'll normally try also fixed pressure later on in the trial as well.
If I get it right, the main thing that we need from this trial is to find the right mask for that patient.
Yeah.
And the right pressure
Yeah.
to get rid of all the apneic events.
Yeah.
Yes,
Correct.
because CPAP machines have pressure settings that can go from 4 centimeters to 20 centimeters. So that's a huge, vast amount of pressure.
Yeah.
And what individual patient needs differs from patient to patient.
For the specific different types of patients, we look at the detail of the report and also tailor the settings to make sure that it suits them. Yeah.
Yes. So as a respiratory specialist, when I refer to Candice, I would say trial of CPAP, and I would leave Candice to decide what mask is required for the patient, because you do a couple of measurements for the mask fitting.
Yeah.
What do you normally look at in a patient to fit the mask?
So obviously their facial structure, their nose, the size of the cushions that I will be looking for.
I get a lot of referrals for sleep apnea. And when I see the patients, one of the common myths people have are that they think if they're sleeping well, there is no sleep apnea. Sleep apnea and sleeping well are completely different things. You can sleep really well whilst you have sleep apnea. Sleep apnea, in essence, is an obstruction of your upper airway, just below your neck here, whilst you sleep, only whilst you sleep, and that reduces the oxygen levels in your blood because there is an obstruction, and it is a mechanical obstruction. And there are many ways to get rid of it, and one common thing is to lose a bit of weight. That would help. But depending on the severity of the sleep apnea, how much oxygen drop you have, what other medical conditions you have, like heart disease or strokes, etc., the treatment has to be tailored to the patient. CPAP, or continuous positive pressure airway treatment, is a very common treatment method for sleep apnea. But that doesn't mean every single patient requires CPAP. Some patients may require surgery, some patients may require mandibular advancement splint, some patients may require a combination of treatment options or a position device. So it's very important, if you have sleep apnea, to see a sleep specialist to really look at your condition, your underlying medical problems, and your lifestyle and your preferences, and find a solution that works for you, a personalized solution. Today we are going to talk about what we're going to do if you are prescribed CPAP by a sleep specialist. So when I prescribe a CPAP to a patient, because I think that is the optimal management for that patient, I want that experience of using CPAP a very seamless and a comfortable experience for the patient. And we find, the research shows that it is the first 2 weeks of using the CPAP machine that patients start getting used to it. And if you give good support during that first 2 weeks, the uptake of that CPAP machine is so much better. There is no way a patient could use a medical device like a CPAP on their own, buying it online, and be successful. There probably is a couple of people who can get it successfully, but you need medical help to get this perfect because it's a medical problem. So I refer my patients to Candice because Candice is experienced and she has worked with my patients and given good results over time. So when I refer patients to Candice for CPAP, I refer for what's called a trial, because whilst I like patients to be using CPAP when it is prescribed to them, not everybody can use CPAP. Some patients just can't tolerate it. So it's very important that we do a trial first to find out what pressure the patient needs, to find the right mask, and to find the right machine for the patient for the patient to use it successfully to completely get rid of the sleep apnea. Candice, tell me, when I refer a patient for a trial, what do you do? What's the first thing you do?
We help the patient to find out what's the most suitable device and what's the most suitable pressure to achieve the optimum oxygen level for the patient, and make sure that they're comfortable and they're tailored for a specific CPAP mask.
So mask is a very important thing. Most patients ask me, what machine should I buy? That's the first thing they ask when I say you need CPAP. It does not matter what machine you buy. There are 3 types of machines that's commonly used in Australia.
Yeah, the top 3 brands I would say is Philips, Fisher & Paykel, and ResMed.
Yes, so it does not matter what brand you buy. What matters is your prescription for your CPAP, which is your pressure, your ramp, your humidity settings, and other comfort factors, and especially the pressures that you need, which is your prescription. That is the most important thing. This is like the prescription of spectacles, for example. The prescription is what matters the most, and the second important thing is the mask, the interface that provides you with the pressure, because the pressure that is prescribed has to go to your lungs. It shouldn't be leaking outside, it shouldn't be hissing or making noises. It has to be comfortable and deliver the pressure. It is again like spectacles, it's like the frame. The brand of the spectacle does not matter. Similarly, the brand of CPAP does not matter. So the other problem is there are a small group of patients who doesn't agree with CPAP and just cannot use it despite trying. So the first thing I tell patients is you need a trial of CPAP. So when I send patients to Candice for a trial, because it's done by a sleep therapist, what do you do, Candice? What happens from there?
We will set the device starting from the prescribed pressure and then look at patient's facial structure and give them a couple of options, try them with different masks, find the right size, and then see how they go in the appointment. And we'll also follow up with them during the trial period and make sure the optimal pressure or the right pressure range, the optimal pressure is found. And then most importantly is they're comfortable and the mask is good for them.
When a patient comes, Candice would fit the mask. And what do you normally look at in the face?
Nose shape, facial structure, whether if it's an Asian sort of facial structure, I will have a couple of different type of masks that I think that suit Asian nose, or a facial structure. If it's a wider face, then I will have in my mind different types of masks that might suit that typical face. And also, if for a side slipper, we might have other options.
And because Candice has worked with patients for so long, Candice is pretty good at guessing the type of mask you need. But how many masks do you normally give a patient, and how important is it for the patient to be physically sitting in front of you for you to figure that out?
Absolutely. In-person appointment is quite important. We would really have to connect to the machine, turn the machine on, and make sure the mask is not leaking, and in a higher pressure, it's also working.
Candice has done this for years, so Candice is very good at guessing what type of mask a patient needs. Tell me, how many masks do you normally give a patient once you figure out what type of mask the patient needs?
Normally, I would give patient, if they don't have any sinus issue, I'll give them a nose mask or a nasal pillow mask, and also as well as a full face mask, so that in case if they do open their mouth, they couldn't change the habit of closing their mouth in their sleep. They would just have to try the full face mask.
And how important is it for you to see the patient physically in front of you with face-to-face appointment?
It's 200% important that we need to see the patient in person. Just because fitting a mask, it's quite different. You can't purely judge on the size, facial structure, nose shape. We really need to try on the patient and turn the machine on in different pressure settings to see how people respond, how people feel, and how the mask is fitting on the face,
Yes, so when I refer to Candice or when I refer for CPAP trials, I usually put 2 levels of pressures between 4 centimeters and 20 centimeters, which is a very big pressure range. And then what do you do, Candice?
I might start people with the prescribed pressure, and I'll look at how they respond. I might adjust the pressure initially, and then if they feel comfortable, they can tolerate the starting pressure. And later on during the trial, I'll look at the mask fitting and see whether there's any other adjustment that I need to change for the pressure range. And after a week or so, if the data is accurate, then we might also get the patient to try other pressure setting.
So the gold standard way of treating sleep apnea is really to find out what is the pressure that would get rid of all of the stopping breathing events. And that is called a fixed pressure, which means that every single breath you're getting the same high level of pressure to control all of your obstructions. Some patients can tolerate this, some patients cannot. So this is why we start patients off with what is called auto set. Automatic setting, where breath by breath is analyzed and the pressure that is required only is given. Sometimes it's a low pressure, sometimes it's a high pressure. So Candice's task really is to figure out what the pressure range you require, and then later on fix it to the 95th percentile of the pressure, the high pressure that you need, so that majority of your obstruction events would be controlled. Yes. What is your experience with fixed pressure versus auto set for patients? Just to clarify, a fixed pressure machine is less expensive than an auto set automatic machine. And we try to get patients to fixed pressure because that is a gold standard treatment. But what is your experience in the comfort levels for patients from automatic to fixed?
By research, it is true that people who are using automatic pressure device more persistent in long term. Obviously, it depends on your fixed pressure. If the fixed pressure is quite strong, quite high, then it will be harder to tolerate. And also it depends on how people sleep. So it's quite different. But we generally found automatic pressure devices are all more comfortable and more people choose automatic device.
And one other thing to add is when you get an automatic device, you can fix it.
Correct,
You need
yeah.
to, but not the other way around.
Correct. So automatic machine can be used as both automatic pressure setting device and as well as a fixed pressure, which we call also manual device, manual setting. Whilst fixed pressure device cannot be upgraded and changed to work as an automatic pressure device. Yeah.
Yes. And during this trial period, how long usually is a trial period?
We can do 2 weeks or 1 month. Obviously, it depends on how people tolerate the CPAP and the mask. If people adapt to new things pretty fast, and I would say 2 weeks it's sufficient to figure out. If they're comfortable, if the sleep apnea is in control, and physicians happy with the result.
The main thing is patients shouldn't fix their mind on, I'm going to get this done in 2 weeks.
No, yeah.
Sometimes
absolutely.
it can take longer.
Yeah, it can take longer than months for people to adapt. It is a new lifestyle change, something new that people will need to adapt to.
At the end of the trial, what do you give patients?
There are options. End of trial, we will suggest people, obviously if for a patient who's moderate or severe and they do prescribe for CPAP, then we would recommend to stay on CPAP. Don't go without a CPAP because it is dangerous for them. If they found it hard to tolerate and they want longer time to think about it, then I would suggest them to continue renting and keep on helping them to find where the problem is, and then hopefully in longer term they can stay on CPAP and don't go without.
So if a patient becomes successful at the 2 or 3 week mark, Candice will provide a prescription, and this prescription will have the mask that worked well for the patient.
Yes, correct. And the pressure and the machine, obviously, yeah.
And the ramp.
Yes, RAM setting. All the settings that the patient need will be summarized on the form, and then patient can go with the settings and then go from there, yeah.
So that is a vital step. So you get that prescription, like the prescription of glasses that is tailored to you, and prescribed mask which is comfortable and tested for you, which is the cornerstone of success for using CPAP. Okay. Having said that, not all patients can do the trial. Sometimes the trial fails, and then we might have to send the patient to an overnight sleep study in a sleep lab. So to wrap up, again, to make this point, if you're diagnosed with sleep apnea, you need to see a sleep specialist to get a tailored treatment plan for you. And one of those treatment plans could be CPAP treatment. And if you're prescribed CPAP treatment, then it's very important to see a sleep therapist, an experienced sleep therapist, so you could get the best mask fitting and the best prescription. Once you start with the trial, it's very important that you have feedback from the sleep therapist and to and fro conversations so that you get the maximal comfort and the best setting for your CPAP machine, and also ongoing support and for maintaining this CPAP treatment, because CPAP is a medical equipment. You need medical support for that. So thank you very much, Candice, for coming to the session. If you have any questions, please let us know in the comments, and we're very happy to answer those questions. And if you have any questions about CPAP treatment or you're struggling with it, please feel free to contact Candice, and we will put in the contact details for Candice in the links below.